that nearly all the trauma work going back years and years was being done mostly in voluntary organisations like Rape Crisis in private counsellors, and that the public sector, the psychiatric services, the NHS, which we have in the UK, were dealing with crisis intervention, but were not really at all interested or able to deal with trauma work. And so one of the areas that I find myself working in more now is that as dissociation is getting known, I get psychiatrists, psychologists from different psychiatric services now using our centre's help. And often the scenario is they may have had patients who've been 15, 20 years in the system, have been in and out of hospital, may have had a multitude of diagnoses, and they still don't know what's going on. And it turns out at the end these are some of the typical background scenarios of someone who may turn out to have complex trauma and dissociation. So one of the main areas that I'm now involved in is to be able to facilitate, I go up to psychiatric services in their own locality. Because what happens is, if finally someone is identified as having a dissociative disorder, then the services want to send them to a specialist unit, usually elsewhere in the country, not that there is a specialist unit for this, and somehow rid themselves of the problem, which creates another split. So what I'm encouraging is for treatment to be provided in the person's own locality. So I'll go up there, I'll assess the patient, I will work with a multidisciplinary team, and I will help select and train a psychologist or therapist to work with them. Now, interestingly enough, the problem is rarely matching the therapist with the patient or client. The problem is the multidisciplinary team, and I call it institutional dissociation, because what happens, partly because of anyone whose complex trauma childhood is based on parents that split, one saying one thing, the other saying the other. For survival, often going for one if they want one thing, the other if they want the other. The same thing gets reenacted in multidisciplinary groups. So that till the multidisciplinary group work well together, there is no point in having a good treatment package in place. That's if a client or patient needs other professionals. Of course, you get clients or patients who are dissociative, who have nothing to do with the medical profession, don't need them, that's fine. But when they do, then the multidisciplinary team needs to be seen as a well-established, functioning parental body, if you see what I mean, in order to replicate in a positive way some of the things that went wrong in childhood. So that becomes where the work is. And the other thing that I have very strong views about in both my private practice and in when someone is using the psychiatric services is that someone coming for help has to be a partner to their recovery. Now, one of the things about crisis intervention in the UK is that the psychiatric services are used to people coming along in crisis and doing whatever they're told to do. And you can't do that anyhow with patients, you shouldn't do. And especially with someone who's had to find ways of surviving and who has this mixture of, on the one hand, knows how to survive in the world, knows how to, is streetwise, knows how to, in any situation, will cope. And on the other hand, can feel completely lost, regressed, frightened like a child. So it is a partnership. So on the one hand, the therapy is where someone needs to be allowed to be dependent, to let any of the parts come out. And outside, in dealings with life and in dealings with professionals, they have to be the adult as a partner to their own recovery, so that no decisions are made without the patient present. They are part of the solution. Anything that's talked about or written about has to be communicated and copied in to the patient. Because one of the things that is quite a difficult from a therapeutic point of view is that someone who has not had what they ought to have been allowed to have as a child, in other words, to have the sort of parenting and the care that they needed, will have a very, very deep longing to be cared for at some level. But the bottom line is they want to be cared for. And if you are there only in the caring capacity, only there as the person who is the helper, nothing changes. The person who has to be able to help their own internal world or their child parts is the adult. And the adult needs to be encouraged to be the parent to their own child. We can be facilitators of that, whether we are therapists or other professionals. And that actually is a very difficult thing to be able to get across to both therapists sometimes, so that they're not rescuers, and also clients, that they have the answer to how to deal with what's going on inside.
So working with dissociated clients and working with organization is quite similar work, right?
Exactly. The same principles apply, absolutely. And in organizational work, it's not that everyone has to be the same, but there is, because parents aren't the same, parts inside aren't the same, but that there is good communication and respect for what's going on for each professional, so that when a decision is made, it's made as a body, and it's not changed till they all meet again. Because what you've got with a client is that it's action-reaction. There's no thinking time. Someone lives from moment to moment. Something comes up, there's no thinking, you automatically go into a response. And what you're wanting is to develop an internal communication, so that before a decision is made, good or bad, we're not there to judge that decision. There is a chance to try and check out what's going on inside, so that there's less chance of a negative reaction.